Why were changes needed for the Advance Directives templates in Consolidated CDA? First, there were technical and semantic problems in the way that verifiers of Advance Directive documents were represented. A verifier is a clinician who reads a person's advanced care plan and verifies the goals and preferences that have been expressed. Did the patient document preferences regarding tube feeding under certain circumstances or resuscitation under certain circumstances? Did he or she document goals for their final days? Did he or she state any preferences regarding organ donation? The verifier's job is to document what sorts of goals and preferences the person has included in his or her advanced care plan. There also were semantic problems in the way that healthcare agents were represented. The set of terms, or value set, available to express the relationship between the healthcare agent and the patient was incorrect. A healthcare agent is a person appointed by the patient to make healthcare decisions on the patient's behalf at a time when the patient can't communicate or decide for his or herself. The value set used to specify the type of advanced directive content in an advanced care plan had some invalid and missing concepts also. Plus, the guidance provided in the templates did not clearly differentiate between information about types of future health goals or treatment preferences versus instructions a person provided at the time of care to request or prohibit certain types of care that may be delivered during that encounter. Clearer guidance about this distinction was needed, and new templates were needed to represent instructions and prohibitions. Additionally, no templates existed to define how to represent information about advanced care planning education or advanced care planning support services. New templates were needed to represent when interventions of this sort were planned or provided. The focus on value-based care is increasing the need for documenting patients' goals and preferences. You can't do value-based care if you don't know what a patient values. Changes to the original Advance Directives templates were needed to ensure relevant use cases for advanced care planning could be addressed. Updates were needed to make the templates fit for their intended purposes. We need to be able to create and share a person's advanced care plan to support emergency as well as critical care needs. We also need to be able to address how that information gets updated over time. The templates need to support the means to access the person's current advanced care plan when the person cannot communicate for his or herself. The templates also need to support the case when the information in the advanced care plan is not yet needed, but needs to be confirmed so that the person's wishes can be clearly understood in case they are needed in the future. We need to be able to document when education or support services are planned or performed to counsel a patient who needs to create an advanced care plan. And we need to be able to document when a person makes decisions at the outset of an encounter about treatment instructions or prohibitions that pertain to that encounter. These use cases and the technical issues discussed earlier were the driving force behind the project to update the C-CDA Advance Directives templates.